Hello, I'm Elita Shafa Najwa. I'm from the Pharmacy Study program at Pekalongan University. Pharmacist job description. Pharmacists dispense drugs prescribed by doctor and other health information to patients about medication and their use. This career requires lifelong learning to keep up to date with new drugs and treatment. What does a pharmacist do? Pharmacists are healthcare professionals responsible for supplying medicine in the most economical and effective way possible. It is an applied medical science. Pharmacists constantly monitor the quality, safety, and the use of medicines, requiring a high level of involvement and interaction with patients. They also need to have a strong knowledge of legislation and professional codes of practice. There can be some confusion between the role of a pharmacist and pharmacologist, but pharmacology is a separate field that involves investigating the effects drugs have on the body. There are three main areas of pharmacists can work in: 1. Hospital pharmacists, 2. Retail or community pharmacists, 3. Industrial pharmacists. 1. Hospital pharmacists. Hospital pharmacists work closely with doctors and are responsible for the ordering, quality testing, storing, and quality of drugs and medicine in hospital. They must also ensure an adequate supply of medicine. 2. Retail or community pharmacies. Retail or community pharmacies supply prescribed and over-the-counter medicines to the general public in retail pharmacies, such as phlebotomists, and give advice to customers on the safe use of medicine and possible side effects. 3. Industrial pharmacies. Industrial pharmacies work in pharmaceutical companies where they help to discover safe and effective new drugs, develop them into effective medicine, and market the finished product to customers. Future pharmacy job. Prospect pharmaceutical industry, education work, government agencies, management, pharmaceutical research, working in the private sector, hospital, pharmacies and clinical laboratories, community pharmacies, drug service administration sections, health counselor. Difference between prescription and over-the-counter drugs. Over-the-counter drug. 1. You don't need a doctor prescription because the abbreviation OTC stands for the over-the-counter, which means it can be bought freely in store or supermarkets. 2. Can be purchased freely such as in store, supermarket, shop. 3. Can be supplied to many people without specification. However, it should be noted that the use of a drug should not be used together because it can increase the risk of transmission. 4. Progress based on self-diagnosis without going to a doctor or a particular hospital. For example, when someone has a toothpaste, they will buy Ponstar, or when they feel dizzy, they will buy Panadol. 5. OTC drugs are quite safe and have minimal side effects. 6. Used to treat minor ailments. 7. Can be dangerous if used incorrectly. 8. Over-the-counter medicines are generally cheaper, but there are also easy medicines which are more expensive than generic medicine. Prescription medicine. 1. You need a doctor prescription when you want to buy it from the pharmacy. 2. must be purchased at the pharmacy accompanied by a clear doctor prescription. 3. Prescribe and give specifically for one person only based on the diagnosis determined by the doctor to the patient. 4. To buy a doctor prescription medicine, a clear diagnosis and certificate of the illness is required from the doctor. 5. It has more side effects compared to OTC drugs. For the reason, a doctor prescription and specification are needed for only one patient. 6. Used to treat minor ailments, but can also be used for more severe ailments. 7. Can be dangerous is misused. 8. The price of medicines prescribed by doctor is generally more expensive because of the expensive content and the patent right of the company that issues them. Thank you.